Hello and welcome to Doctor's Orders here at the Chrissy B Show. I'm Dr. Rob Hicks. Today we're going to be talking about a condition that tragically kills over 73,000 people every year in the UK. It kills around about 1 in 6 men and around about 1 in 10 women. And that condition is coronary heart disease. It's also known as ischemic heart disease, or very simply, heart disease. Now, if you think about your heart, which is about the size of a fist, being a simple muscle, its job is to pump blood around the body, to deliver oxygen and nutrients all around the body where the organs need them. Now, the heart is an organ as well, and so it needs a supply of oxygen and it needs nutrients as well. And it gets these through arteries called the coronary arteries. That's where the term coronary heart disease comes from. Now, if the blood flow to the heart is reduced or indeed blocked off, then that's where problems occur. If it's reduced, you get symptoms in the chest called angina chest pain, that feel like a crushing tight band across the chest. If the blood supply to the heart is completely blocked off, then you suffer a heart attack because that part of the heart just isn't getting the oxygen that it needs. So why is it then that this happens? Well, this happens through a process called atherosclerosis, which simply means that the arteries are becoming narrowed, they're becoming furred up, and that's what's blocking the efficient flow of blood. Within the arteries forms a yellow, gooey mess called atheroma. It's not unlike the colour of my stethoscope tubes, but it sticks to the artery walls and it narrows them so the blood can't get through efficiently. So what is it that causes this narrowing, these fatty deposits to form in the artery walls? Well, certainly being overweight increases the risk, smoking increases the risk, having high cholesterol increases the risk. High blood pressure and diabetes also increase the risk of damage to the arteries, so that problems are likely to arise. So how do you go about trying to prevent this from happening? Well, you get rid of the risk factors. If you're overweight, a healthy diet, cutting down the calories, doing lots of exercise should help bring you down to a healthy weight. If you smoke, you don't need me to tell you this, it's the best idea is to quit, to pack it in. And get yourself checked for high blood pressure, high cholesterol and diabetes, because if you should have any of these conditions, they can be treated. And when they're managed, the risk of damage to the arteries and the complications that come with that can be reduced. If somebody already has heart disease, then certainly the lifestyle measures are still very, very important. They will also be offered medication. So medication to reduce the risk of clots, medication to improve the function of the heart, and medication to manage high cholesterol, high blood pressure and diabetes. They may also be recommended to have a surgical procedure. This might be something called angioplasty, where a balloon essentially is put inside the narrowed artery, it's inflated to widen that artery so the blood can flow through more easily. Or they may actually have heart surgery to bypass a blockage called CABG, coronary artery bypass grafting. Now, if you would like to know whether you are at risk of heart disease or what your risk is, or you already have heart disease and you want to get some more information, then please do have a word with your own doctor and seek their advice. And that's Doctor's Orders.